Early cancer warning signs you must never ignore. Dr. David's advice. Hello everyone, I am Dr. David. You know, during my nights on duty at NHS Emergency Departments, in the UK, amidst the constant wail of ambulance sirens and the harsh white neon lights, what haunted me most was not the work pressure. What kept me awake at night were the if-only moments. It is the regret in a father's eyes when he learns that the dull abdominal pain he had for 3 months was not indigestion. It is the deadly silence of a mother realizing that the small streak of blood in her cough was not from a sore throat. They all had one thing in common. They were incredibly busy people, the heroes of their families, and they always told themselves, I'll just finish this task before I see a doctor, or, I'm probably just tired because I'm getting older. But in medicine, the line between it's nothing and it's too late can be as thin as a breath. I am standing here today, not to spread fear. I am here to give you the most powerful weapon to protect yourself and your loved ones: knowledge. I want you to know exactly what we, emergency doctors, are trained to look for. These are the red flags from the NICE, National Institute for Health and Care Excellence, guidelines, the strictest set of standards for doctors in the UK. Before we dive into these secrets, please take just 2 seconds to click the subscribe button and turn on notifications. Because among billions of entertainment videos out there, a health knowledge video appearing at the right time could be a lifesaver for your family. Please leave a greeting or any questions below. I promise to take the time to answer them for you. We will start with one of the most common killers in the UK and a top concern in geriatrics: colorectal cancer, bowel cancer. What is the most terrifying thing about this cancer? It doesn't cause severe pain immediately. It is very subtle, creeping into your life through tiny changes that you often dismiss. Let's analyze the alarm milestones by age. If you are over 40, be especially alert to the words, unexplained. Are you losing weight, with clothes becoming loose even though you aren't dieting or exercising intensely? Is this accompanied by dull abdominal pain or bloating that comes and goes? Do not blame work pressure or stress. The NICE guidelines are very clear. This is a combination that needs urgent investigation through endoscopy. When you are 50 or older, any sign of bleeding from the digestive tract, rectum, is a red flag. The biggest mistake I have ever seen is patients self-diagnosing as having hemorrhoids. Yes, piles can cause bleeding, but if a doctor hasn't examined you and confirmed another cause, any blood appearing at this age must be considered suspicious for cancer until proven otherwise. This is the standard for a general practitioner, GP, to put you on a 2-week wait list, the most urgent referral category. At age 60, your body has its own voice. Pay attention to 2 things. Iron deficiency anemia. Do you feel tired, short of breath, or look unusually pale? When a blood test shows iron deficiency without an obvious cause, like a stomach bleed, we must immediately think of a tumor silently consuming your blood in the colorectal tract. Change in bowel habits. Are you going to the toilet more often than usual? Or suddenly suffering from persistent constipation? Has the shape of your stool changed, becoming thin like a pencil? If this lasts for several weeks, it isn't the food, it's a signal from your colon. Next, let's talk about a subject many people dismiss: lung cancer. I understand what you are thinking. Dr. David, I never touch a cigarette. This isn't for me. I wish that were true. But reality in the emergency room has taught me otherwise. Lung cancer still strikes those with the healthiest lifestyles, those who jog every morning and eat organic. Smoking is the biggest risk factor, but not the only one. We have all had a cough from a cold or a sore throat. But remember this number, 3 to 6 weeks. If a cough lasts longer than this without improving, or if the character of the cough changes, from a dry cough to a productive one, or your voice becomes persistently hoarse, you need a chest X-ray immediately. Do not wait for it to go away on its own. The technical term is hemoptysis, but we simply call it coughing up blood. In my world, there is no such thing as, it's just a little bit of blood, so it's fine. Even a few small streaks of blood in your mucus is an extremely serious red flag. It requires medical intervention on the same day. If you feel sudden shortness of breath, sharp chest pain when breathing deeply, accompanied by extreme exhaustion, stop everything and call for an ambulance. It might not just be a tumor, but a blood clot, pulmonary embolism, that is life-threatening. NICE advises doctors that for smokers over 40, just one symptom like fatigue, weight loss, or unexplained chest pain warrants a chest X-ray within a maximum of 2 weeks. When mentioning breast cancer, most people immediately think of women. But gentlemen, please stop for a moment. Men also have breast tissue and men can also get breast cancer. In fact, because men are often complacent and never think to check, the disease is often at an advanced stage when discovered. Whether you are male or female, look out for a new, painless, hard, and fixed lump. That is the most typical sign. Additionally, observe the mirror for changes on the skin surface. Skin dimpling or puckering. It looks like the surface of an orange peel, peau d'orange. Nipple changes. The nipple suddenly turns inward, inversion, when it didn't before, or there is abnormal discharge. Swelling in the armpit. Sometimes a lump doesn't appear in the breast but is located in the lymph nodes under the armpit. This is the part one particularly want women and their husbands to take to heart. Ovarian cancer has a terrifying reputation as the silent killer, because its symptoms are extremely vague and easily confused with common digestive issues. 4 golden signs to remember. Persistent bloating. Not the kind of bloating after a big party that goes away, but a feeling that the abdomen is always swollen, lasting day after day. Feeling full quickly. You've only eaten a few bites and already feel full, accompanied by a sudden loss of appetite. Pelvic or lower abdominal pain. Dull pain without an obvious cause. Urinary symptoms. Needing to urinate more urgently or more frequently than normal. If you experience any of these symptoms more than 12 times a month, especially for women over 50 or those who have gone through menopause, do not accept the answer, it's just stress, or it's indigestion. Ask your doctor for a CA-125 blood test and a pelvic ultrasound. Your decisiveness at this moment is the key to protecting your life. There are signs we can see if we observe closely enough. In medicine, we have an iron rule. Seeing blood in your urine, hematuria, means you must see a doctor immediately. The urine might be light pink, bright red, or even dark brown like strong tea. Even if it appears once and disappears, you must not ignore it. It could be a sign of bladder or kidney cancer. Especially if you are a smoker, as smoking increases the risk of bladder cancer many times over. This sign needs priority urgent investigation. Melanoma is the most dangerous type of skin cancer because of how quickly it spreads. However, it is the easiest to detect if you memorize the ABCD rule when self-checking moles. A. Asymmetry. If you draw a line through the middle of the mole, the two halves do not match. B. Border. The edges of the mole are ragged, notched, or blurred into the surrounding skin. C. Color. The mole has multiple colors, patches of black, brown, red, or even blue-white. D. Diameter. The mole is larger than 6 millimeters, about the size of a pencil eraser, and is growing larger. E. Evolution. This is the most important factor. A mole that was previously normal suddenly changes shape, color, or starts to itch or bleed. When the brain sends out a distress signal, tumors in the brain and central nervous system often manifest through the progression of symptoms. Pay attention to a strange headache, a headache that is worst in the morning, severe enough to wake you up, or accompanied by vomiting, projectile vomiting. Progressive neurological deficit, sudden weakness in the limbs, poor coordination, blurred vision, or changes in personality and sudden memory loss. In children, any abnormal neurological signs should be checked by a specialist within 24 to 48 hours. Unexplained weight loss. The most encompassing red flag. If there is one symptom I want you to remember most from both parts of this video, it is unexplained weight loss. Many different types of cancer send their first signal through the body losing weight rapidly without any effort in exercise. If you lose about 5 to 10% of your body weight within 6 months without a clear reason, consider it a medical emergency. Do not assume it is just old age. In old age, sudden weight loss is even more concerning. Everything we have discussed, from beginning to end, revolves around one single keyword: unexplained. Your body is a miraculous machine. It always knows how to send signals when something is wrong. The question is whether we are quiet enough to listen and determined enough to act. I understand that booking a doctor's appointment can sometimes be very difficult and time-consuming. But remember, you are the person who knows your body best. If you see a red flag, be persistent. Tell your doctor exactly what symptoms you are experiencing. That persistence not only brings peace of mind, but it could also grant you several more decades of life to see your grandchildren grow up. Thank you for listening to this very long sharing of mine. I hope that the knowledge from NICE and my experience from the NHS will be helpful to you. Now, take a second to comment below the phrase, "I understand." This is how you commit to yourself that from today, you will listen to your body more. I am Dr. David, wishing you to always live healthily, beautifully, and proactively. See you in the next videos. I could help you with professional script formatting or health-related channel tags for your next video. Would you like me to do that?